Assalamu alaikum everyone. My name is Taibasi. Today I am going to discuss about a pneumonia. Definition of pneumonia. It is the inflammation of the lung parenchyma typically caused by infection. Inflammation is a process where the body's immune system reacts to injury or infection, often causing swelling, redness, pain, and heat. Lung parenchyma refers to the functional tissue of the lungs, which includes the alveoli where gaseous exchange occurs. Pneumonia typically caused by infection. The most common reason for pneumonia is an infection from various microorganisms. This diagram visually illustrates what happens in pneumonia. It shows a healthy alveolus and inflamed alveolus filled with fluid and pus. Etiology of the pneumonia. It refers to the various causative agents responsible for the infection of the lung parenchyma. Pneumonia can be caused by a range of microorganisms, including bacteria, viruses, fungi, and atypical pathogens. The likely cause depends on factors like the patient's age, immune status, setting, and comorbidities. First one is bacterial causes, which includes Streptococcus pneumonia, which is the most common cause of community-acquired pneumonia. Second is Haemophilus influenza and Staphylococcus aureus. Viral causes. It includes influenza virus, which is most common in seasonal outbreaks, respiratory syncytial virus, which is common in infants and elders, adenovirus. Third is fungal causes. Histoplasma capsulatum, which is common in immunocompromised or endemic regions, blastomyces dermatitis, pneumocystis jirovecii, which is most common in immunocompromised patients, for example, HIV or AIDS. Aspiration. Aspiration pneumonia is caused by inhalation of oropharyngeal or gastric contents. Common organisms including aspiration pneumonia are anaerobes like bacteroids or fusobacterium, etc. Risk factors. Pneumonia risk is elevated in individuals aged over 65 years due to declining immune function and the presence of chronic illness, while children under 5 years are vulnerable because of their immature immune systems and smaller airways. Smoking impairs the respiratory tract's natural defenses by damaging cilia and promoting infection. Chronic diseases such as chronic obstructive pulmonary disease, diabetes, heart failure, and kidney disease further compromise the body's ability to clear infection and respond effectively. Additionally, weakened immunity, whether from HIV, AIDS, cancer therapy, organ transplants, or immunosuppressive drugs, greatly increasing susceptibility to pneumonia by reducing the body's capacity to fight off invading pathogens. Pathological classification. Lobar pneumonia, bronchopneumonia, interstitial or atypical pneumonia, aspiration pneumonia. Classification of pneumonia, which is based on the etiology: community-acquired, nosocomial, aspiration, and immunocompromised host. Lobar pneumonia. It is a type of bacterial pneumonia characterized by acute inflammation and consolidation of entire lobe of the lung, typically caused by Streptococcus pneumonia. In lobar pneumonia, the infection spreads rapidly through the alveoli of a single lobe through the pores, leading to a uniform consolidation, which is also known as solidification of lung tissue due to the accumulation of exudate. This results in impaired gaseous exchange and clinical symptoms like fever, productive cough, and chest pain occurs. It progresses through four pathological stages and reflecting the body's response to the infection and eventual healing. It is distinct from bronchopneumonia, which involves patchy inflammation affecting multiple lobes or segments. Pathology of lobar pneumonia. It involves a well-defined sequence of inflammatory changes that typically affect a single lobe of the lung. It progresses through four classical stages. First one is congestion, which is from day 1 to day 2. Caused by initial infection, the alveolar capillaries become congested with the blood in congestion. Alveoli begin to fill with a protein-rich exudate containing bacteria. Lungs appear heavy, red, and bulgy. Second stage is red hepatization. from day 2nd to day 4. Alveoli are filled with red blood cells, neutrophils, and fibrin. The lung becomes film and liver-like, hence it is known as hepatization. This stage reflects intense inflammation and consolidation. Third stage is gray hepatization from day 4 to day 6. Red blood cells break down, leaving a grayish appearance. Neutrophils and fibrin persist and macrophages begin to appear. The lung remains film but turns pale gray. Fourth stage is desolation. Day 7 to onwards, macrophages clear the debris and exudate from the alveoli. Normal lung architecture is gradually restored. Lung returns to its normal position, normal consistency or spongy consistency. This diagram really illustrates how the pathology of lobar pneumonia works. Bronchopneumonia. It is characterized by a patchy inflammation affecting the bronchi, bronchioles, and adjacent alveoli, often in a scattered and bilateral distribution. The pathology begins with acute inflammation in the small airways, leading to an accumulation of neutrophils, exudate, and cellular debris in the alveolar spaces, resulting in the consolidation in isolated areas. Inflammatory cells infiltrate the alveoli and fibrin and proteins may be deposited. Over time, the infection can cause localized necrosis or abscess formation if unresolved, and the affected lung tissue may develop scarring. Chest X-ray typically shows patchy infiltrates, and the inflammation may extend from the airways into the surrounding lung parenchyma, causing bronchial and peribronchial inflammation with the alveolar exudates. Common symptoms of a bronchopneumonia includes fever. It can be often high, cough, which may be productive with a yellow or greenish sputum, shortness of breath, which is also known as dyspnea, chest pain or discomfort, having often aggravated by a deep breathing or coughing, fatigue, wheezing, trachypnea, cyanosis, and confusion. Atypical pneumonia or interstitial pneumonia. It is a type of pneumonia that primarily affects the interstitial tissue surrounding the alveoli, leading to the inflammation and in some cases fibrosis. It is often caused by a viral infection like influenza, RSV, or coronavirus, but can also result from autoimmune diseases or environmental factors such as hypersensitivity pneumonitis. Unlike typical pneumonia, which affects alveolar spaces, atypical pneumonia causes stiffness in the lungs due to the inflammation of the interstitial spaces, leading to the symptoms like dry cough, shortness of breath, and fatigue. Chest imaging often shows bilateral diffuse infiltrates or reticular opacities. The condition may progress to fibrosis, impairing lung function and oxygen exchange. Aspiration pneumonia. It is a lung infection that happens when food, liquid, saliva, or vomit accidentally enter the lungs instead of the stomach. This is most common in a people who have difficulty swallowing or a weakened cough or gag reflex, such as those with a stroke, dementia, or under sedation. The inhaled material introduces bacteria, especially from the mouth into the lungs, leading to the inflammation and infection. Symptoms often include cough, fever, difficulty breathing, chest pain, and foul-smelling sputum. It usually affects the right lower lobe of the lung because of the airways anatomy, and the chest X-ray often shows localized infiltrates or signs of the lung inflammation. Pathophysiology of pneumonia. The pathophysiology of pneumonia begins with infectious agents like bacteria or viruses enter the lungs and reach the alveoli, usually by inhalation or aspiration. Once inside, they multiply and trigger the body's immune response, leading to inflammation. Immune cells such as neutrophils and macrophages are sent to the infection site, releasing chemicals that fight the pathogens but also cause swelling and increase capillary permeability. This allows fluid immune cells and proteins to leak into the alveoli, causing alveolar damage and filling the air spaces with the exudate. As a result, gas exchange is impaired, leading to a symptoms such as cough, fever, shortness of breath, and reduced oxygen levels in the blood. Clinical manifestations. The clinical manifestations of pneumonia can vary depending on cause, severity, and the patient's age and overall health. Common symptoms include fever, chills, and productive cough with a yellow, green, or rusty sputum. Patients often experience shortness of breath, chest pain, especially when breathing or coughing, fatigue, and loss of appetite. Other signs may include tachypnea, tachycardia, and crackles or decreased breath sounds on a lung oscillation. In elder patients, pneumonia may cause atypically with confusion, weakness, or a decline in functional status even in the absence of fever. This diagram shows how pneumonia affects the body. Diagnostic evolution of pneumonia. It involves a combination of clinical assessment and tests to confirm infection, identify the causative agent, and assess severity. A chest X-ray is a crucial for detecting lung infiltrates or consolidation, confirming the presence and extent of pneumonia. CBC or complete blood count often shows elevated white blood cells indicating infection. A sputum culture helps identify the specific microorganism causing the pneumonia and guides antibiotic selection. Blood cultures are used to detect if the infection has spread to the bloodstream. Pulse oximetry measures oxygen levels in the blood and helps assess how well the lungs are functioning. In more severe or unclear cases, bronchoscopy may be performed to directly visualize the airways and collect deep lung samples for further testing. Management of pneumonia. It involves treating the underlying infection and supporting the patient's respiratory function. Antibiotics are the main treatment for bacterial pneumonia and selected based on the likely organism and patient factors. Treatment may start with the broad spectrum antibiotics and be adjusted once culture results are available. For viral pneumonia, such as that caused by influenza or COVID 19, antiviral medications may be used when appropriate. Supportive care. It includes rest, hydration, fever control with antibiotics, and cough management. Oxygen therapy is given to the patient with low blood oxygen level to help maintain adequate oxygenation and prevent respiratory distress. In severe cases, hospitalization and more intensive respiratory support may be required. Preventive measures for pneumonia. It focuses on reducing the risk of infection and strengthening the immune system. Vaccination is one of the most effective way to prevent pneumonia, especially in children, the elder, and the people with chronic illness. Common vaccines include the pneumococcal and influenza vaccines. Frequent hand washing helps prevent the spread of viruses and bacteria that can cause pneumonia. Maintaining a healthy diet and doing regular physical exercise boost overall immunity and lung function. It is also important to give up smoking as smoking damages the lungs and weakens their ability to fight infections, making individuals more vulnerable to pneumonia. Thank you.